name is Mahmood, I'm an ENT surgeon in Oxford, and I've really become interested in how we buy goods and services for the NHS. And really it started when I was travelling through Sialkot in northern Pakistan, which is where my parents grew up. Whilst I was there, one of my cousins asked me if I wanted to see how surgical instruments are made, knowing that I was a surgeon. But what I saw there then actually shocked me. This is a big industry. It's 100 million instruments every year, 50,000 labourers, but unfortunately also including 6,000 children working in this industry, some as young as 7. They get paid between $1 up to $3 per day, which is inadequate for their family, even by Pakistan's own assessments. The adults will work 12 hours a day, 7 days a week, and of course when costs are so low, health and safety doesn't get much of a look in. The surveys that have been undertaken of children show that 50% of them have reported injuries, sometimes very serious. 80% of them have musculoskeletal pain, and they're exposed to toxic chemicals. And this is the problem. If we're just asking about price, this is what we engender. What we need is new systems and new processes. So what are the new systems? How can we make things better? Well, the easy solution and the old solution, which doesn't work, is to boycott. Just brush it under the carpet, not our problem, we won't buy that product. Clearly, that's not going to help anything or anybody. A second system is a process of audit. Well, let's just tick the box. Let's say, okay, you have to meet a certain labour standard, and if you tick the box, then that's okay, and we'll keep checking on you. And that seems like a good process, and that's certainly what has been used in the past, but to me, it just identifies the problem. It shows you what the problem is. It doesn't provide you with the solution. And we know from other areas that 90% of audits, for example, in China are faked. And it's like policing people. It's not actually saying, let's work together to work through these solutions. Audit is good, but it just identifies a problem and it doesn't cure the problem. The solutions, unfortunately, as with all these things, are complex and difficult. And what we need is new systems and new processes to create change. But we have experience from other sectors. We have experience from, in particular, agricultural products and textile. So what I'm telling you is nothing new. There's been movements for ethical, fair trade for a long, long time. And what we need to do is encompass that within healthcare. And considering that we spend over $3 trillion per year in healthcare, really, we've got a tremendous possibility for change. So what progress have we made so far? Well, I'm part of a European movement. I want it to be a global movement, of course. We need to all work together. In Sweden, they have policy across the whole of the country that says we will try to procure ethically. It's one thing to have a policy. Actually engendering that, we're on a journey. They've got some contracts for uniforms, for surgical instruments, for gloves, to try and see how we can change things. But we need to be careful that we work together with industry to actually create real change rather than ticking boxes. In the UK, the NHS supply chain, which is the single largest supplier to the NHS in England, has put in place a labour standards assurance system, which is a very good system. It says that if you're going to supply to the NHS, you need to demonstrate that you have a system in place that monitors labour standards, that shows that you can continually improve. And when we find problems, let's work together to see how we can improve things. Scotland is about to follow suit. So the issue is, well, do we have to beat everybody with a stick? We all do need to get together, and we all, if we believe in this and you want to follow on this journey, we all need to work together to create a global community that says this is what we want. But it's not just a stick. What we know from private industry is, who've been working on ethical procurement for a long, long time, is that it actually works as in a business sense. We talk about the triple bottom line. This is a win-win for everybody. So I work with an organisation called the Ethical Trading Initiative, who are based in London. They've been doing this for over 15 years now. They say that companies usually join them when there's a big media story and it's, shock of the working conditions for their products. But they stay. They don't leave. And the reason they don't leave is that they find it makes good business sense. Perhaps it's not surprising that if you pay workers adequately, that they take more pride in their work, that they don't leave their jobs. You get reduced worker turnover. You get a better quality product, which means reduced product turnover. You get increased productivity. And actually, most companies that have been doing this for some time find that it is economically cost neutral or even saves them money. It's good business sense. So, we're early in this journey, and I hope that some of you will want to join us and create a global community. As I come back to you, my job is about the provision of healthcare, and of course we can expand our concepts and modify our systems and processes so that when we think about healthcare and the provision of healthcare, it's the global community and global health that we consider. Thank you. And these are the things that I think makes me think, what do we actually really value? Is it the provision of healthcare and the economics and so on, or is it about trying to make sure that we build a world that values healthcare globally?
Are there many children involved in this work?
Yes, I've seen children with my own eyes. The last estimates were in the region of 6,000 children working in this industry. And although the industry will say that they've reduced the numbers, the reality is that that has not occurred.
And what do you feel that people in Britain could do to change this appalling situation of child labour, or even their parents presumably are being exploited?
Yes, the child labour is just a symptom of a wider problem in that we don't value the work that people do, and this is really important for their health. What can we do? Well, what we can do is make sure we demand basic standards are met, that we say, well, okay, we're going to buy goods and services for healthcare, but as a minimum, if you're supplying to healthcare, you must ensure that labour standards are met. That's a minimum before we even start to talk about price and quality and those sorts of things. This is a basic tenet of the fundamental provision of healthcare around the world.
So into the environmental principles that are already beginning to sort of be pushed by people and meeting some resistance, you're also now introducing human rights elements. Isn't this going to be kind of tricky to get this across as well?
It is tricky. These things are not easy. These things are difficult. But what's encouraging is that we're in a world now where people are starting to do this, and people are starting to realise that actually the triple bottom line works together. So if you try to save carbon, if you try to pay people properly and ensure worker retention and better productivity of workers because they're happier in their work, it actually makes good financial sense. And certainly in the private sector, more and more companies are signing up to this. And they're not signing up so that it looks good on their annual report. They're signing up because for their business it works well.
How come? How come it is not just more expensive?
Well, there may be, for example, with ethical procurement, it may be that initially it is a bit more expensive because a bit of investment is required in your workforce in putting in place new systems and processes. But experience from other sectors, for example, textile or agriculture, shows that actually once you start to pay workers properly, they stay in the work. They don't leave, so you don't have to keep retraining staff to do the job. They increase their productivity because they're happier at work, and they increase the quality of the product, so you have less reworking. And so the companies that have been doing this in the private sector for some time actually find it doesn't cost more, and actually often it costs less. The other advantage is by becoming closer to your workers, you cut out a lot of middlemen and you get an efficient supply chain.
So it sounds like a win-win-win-win-win.
Absolutely, it is a win-win-win-win in the long term, and this is what we need to think. We need to think of new ways of doing things, but absolutely it's a win-win.
So you sound like somebody who wants to think long-term rather than short-term, and think globally rather than think only about your immediate, the people you're caring for immediately, because it has ramifications further afield.
Yeah, I think that's the only way we can think now. The world, we recognise this world as globalised in many ways, in terms of media, in terms of trade. But unless we all work together across the globe to tackle these really difficult problems with the environment, with working conditions, that's the only way these things are going to work. And actually, yes, the answers are about changing the systems. We've gone down a path, and the path has been very successful up until now, but now we're starting to see the harms of the ideas that we've had, this sort of, focus on money and generating more and more. And now we can start to think, well, actually, there's another path, and perhaps we should value things other than just the money and the trade, and we should value health. And if health becomes a currency, then there's a different system we need.